welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Rise in pregnancy-related complications during COVID-19 pandemic. In a paper published in JAMA Network Open, physicians, scientists assessed how pregnancy-related complications and obstetric outcomes changed during the COVID-19 pandemic compared to pre-pandemic. Looking at the relative changes in mode of delivery, rates of premature births, and mortality outcomes before compared to during the pandemic, the team found increased odds of maternal death during delivery, hospitalization, cardiovascular disorders, and obstetric hemorrhage during the pandemic. Molina and colleagues analyzed data from more than 1.6 million pregnant patients who gave birth in 463 US hospitals in the 14 months prior to the advent of COVID-19 and during the first 14 months of the pandemic. There were no statistically significant differences in the two groups' demographic characteristics, including age, race, and ethnicity, insurance types, and comorbidities. The team saw a 5.2% reduction in total live births during the pandemic period. Their analysis also revealed maternal death during delivery hospitalization increased from 5.17 deaths per 1 lakh pregnant patients prior to the pandemic to 8.69 deaths per 1 lakh pregnant patients during the pandemic, a small but statistically significant increase. The research team also saw shortened stays in the hospitals. The team also saw a decline in sepsis rates during the pandemic, likely the result of enhanced hand hygiene and masking due to COVID-19. Nanometric photodiodes to study the activity of neurons. A jolt of light to modulate the activity of a single neuron in real time. This is how innovative nanometric photodiodes work, the protagonists of a new research study published in Science Advances. The technique developed by Professor Laura Ballerini's team at CISA in Trieste in collaboration with the Universities of Chicago and Cambridge is a truly innovative and sophisticated one. When activated with an infrared ray, photodiodes of nanometric dimension are able to send an electric message to nerve cell to which they are bound, regulating its function. The effect of the stimulation can then be extended and amplified to the surrounding network of neurons in virtue of their synaptic contacts. Working like a real electrode but with a non-invasive and very selective approach, these nanotechnologies could be extremely useful for basic research to investigate in-depth mechanisms of the nervous system, but also to develop targeted therapies for neurological diseases. Children hospitalized with COVID-19 or MIS-C who have lingering complications. As part of the National Overcoming COVID-19 study, investigators led by Adrienne Randolph of Boston Children's surveyed family caregivers of patients under age 21 who were hospitalized with COVID-19 or multi-system inflammatory syndrome in children, acronym MIS-C. Of these children and youth, roughly 40% were hospitalized with acute COVID-19 and roughly 60% with MIS-C. 50% and 86% respectively were admitted to the intensive care unit. At 2 to 4 month follow-up, 27% of patients with acute COVID-19 and 30% of those with MIS-C had persistent symptoms, activity impairment, or both. Of the children and adolescents with lingering symptoms, the most common symptoms were fatigue or weakness, shortness of breath, cough, headache, muscle and body aches, fever. Activity impairment was somewhat more common after MIS-C than after acute COVID-19. 3 factors predicted an increased risk for a prolonged recovery or activity impairment, like more organ system involvement in patients with acute COVID-19, underlying respiratory conditions, usually asthma in patients with MIS-C, or obesity in patients with MIS-C. Now that vaccines are available, I strongly recommend that children and adolescents get vaccinated, said lead researcher Adrienne Randolph. We know that patients can be reinfected even if they have had COVID-19, and we previously showed that vaccination can prevent MIS-C and severe COVID-19, she added. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.